Ever wonder how doctors figured out what was wrong with you before x-rays, MRIs, and all that fancy lab equipment? It's a fascinating story of incredible observation, sharp senses, and a bit of detective work. Let's travel back in time and see how these medical pioneers practiced their art. First and foremost, doctors were masters of observation. They didn't just glance at a patient, they studied them. The color of their skin, was it yellow like in jaundice, or pale like in anemia? The way they walked, was there a limp, a shuffle, or a tremor? Even the look in their eyes could give clues about their overall health and vitality. Every little detail was a piece of the puzzle. Then came the power of touch, or palpation. By pressing on different parts of the body, a doctor could detect a lot. They could feel for lumps, swelling, or areas of tenderness. Is the liver enlarged? Is there fluid buildup in the abdomen? A skilled physician could even assess the size and position of a baby in the womb just by feeling the mother's belly. This hands-on approach gave them a physical map of what was happening inside the body. Listening, or auscultation, was another crucial skill. Before the stethoscope was invented in 1816, doctors would literally press their ear against a patient's chest. They listened for the rhythm of the heartbeat and the sounds of breathing. Was there a gurgling sound in the lungs suggesting fluid? Was the heartbeat irregular or faint? The stethoscope amplified these sounds, making diagnosis much more accurate. But the fundamental principle of listening remained the same. And believe it or not, they even used their sense of smell. Certain diseases have distinct odors. The sweet, fruity smell on a person's breath could indicate diabetic ketoacidosis. A foul, ammonia-like scent might point to kidney failure. While it might sound strange to us today, the nose was a surprisingly effective diagnostic tool for a well-trained physician. Let's not forget the patient's story. A doctor would ask detailed questions, not just about the main complaint, but about their lifestyle, diet, family history, and daily habits. This comprehensive history was often the most important part of the diagnosis. It provided the context for all the physical signs. A persistent cough in a coal miner told a different story than the same cough in a farmer. They also examined bodily fluids, though in a much more direct way than we do now. The practice of uroscopy, or inspecting urine, was common for centuries. Doctors would check its color, clarity, and even its taste. A sweet-tasting urine was a classic sign of what we now know as diabetes mellitus, which literally means honey-sweet urine. So, while we're incredibly grateful for modern medical technology, it's amazing to look back at the sheer skill and ingenuity of doctors from the past. They relied on their five senses, their vast knowledge, and their ability to connect with their patients on a deeply human level. They were true medical detectives, piecing together clues to solve the mysteries of the human body. It's a powerful reminder that at the heart of medicine, there's always been a combination of science and art. Thanks for watching. If you found this journey into medical history interesting, please give this video a thumbs up and subscribe for more. See you next time.